Thank you, sir. When the United States rejoined the World Health Organization, you wrote in a statement that meant, quote, holding it to the highest standards. Does that mean that the World Health Organization had failed to meet those standards at some point? And then what specifically is this administration doing to make certain that they are held to those standards?
So we have made clear from the beginning of this administration and in rejoining that we believe the WHO does need to be reformed. Some of those reforms are more programmatic and bureaucratic. They relate to ensuring greater efficiency and effectiveness in responding to things like the outbreak of COVID-19. Some of them are about making sure that there is not undue influence or interference by any single member state or country in the WHO. And then some of them relate to very targeted issues like the COVID-19 origins investigation, where I have personally and we collectively have been quite vocal about our view that there needs to be a second round to this investigation that truly gets to the heart of the matter, which is the original data and original information that is still being withheld by China. And our hope is that in the coming months we will see a credible international investigation progress, including in respect to those items. Yeah.
Thank you, Jake. What is your expectation for when the U.S. will lift travel restrictions on the U.K. and on Europe? And what are your current concerns? Why haven't they been lifted yet? What specifically are you looking for to have happen for that to happen?
Well, let me start by saying it doesn't really matter what I am looking for personally, because at the end of the day, this is a process being driven by science and public health guidance. And so it is ultimately up to the public health professionals in the U.S. government to make that determination. We have heard very clearly the desire of our friends in Europe and in the UK to be able to reopen travel across the Atlantic Ocean. And we want to see that happen. But we have to follow the science and we have to follow the guidance of our public health professionals. So we are actively engaging with them to determine the time frame. And I can't give you a date today, but I will tell you that we recognize the concern and we are fundamentally being guided by objective analysis in this regard.
What is your response to arguments that those continuing restrictions on the UK and European countries are unfair, given that there are other countries that the U.S. does not have travel restrictions on?
My view on this is we have been transparent and clear about the basis for our travel restrictions. We have done so through a process that has been guided by science and evidence. That is how we've determined how the travel restrictions have been applied and to whom, and that is how we are going to proceed on a going forward basis. This administration's commitment to that kind of analysis is fundamental. It is what has guided every aspect of our response to the pandemic, including this issue.
Thank you.
Yeah.